All right, we're going to go ahead and get started. Just a reminder, you are in the supporting families with children on the autism spectrum through home visiting. I'd like to introduce you to Amber Dejmal. Amber?
Hi, everybody. I'm glad to be here today. Yes, and my name is Dejmal, like a mole that comes out in the day. I am the owner of Behavioral Training Solutions, and I am so glad that you are here for our supporting families with children on the autism spectrum through home visiting. All right, so a little bit more about me. Like I said, I'm the owner of Behavioral Training Solutions. It's a company here in the Wichita area. We provide autism therapy and parent training and support for children in the Wichita and surrounding areas that have a diagnosis of autism spectrum disorder. I am also the president of Kansas Parents as Teachers Association, a certified autism specialist, and a certified parent educator. I have been in this particular field about 6 years now as a clinician, and I've been doing home visiting in Kansas for the last 10 years. And 15 years total. So I was in Colorado before that, also providing home visiting services there. A little bit about my education. So I have a bachelor's of health and human sciences from Colorado State University. I majored in human development and family studies and minored in early childhood education and gerontology. I have a master's of education also from Colorado State University, and I specialize in education and human resource studies. I have an autism specialist certification from the University of Kansas Medical Center as well. So our outline today is we're going to talk a little bit about what is autism spectrum disorder, some autism statistics, navigating the diagnosis, and the role of a home visitor in supporting families, and then some practical strategies and tools for home visitors. And then at that point, we should have enough time to open it up for question and answer, and I'll have you just type in some questions at the end of the session during that time, because right now I can't see any questions from my end that are coming up, so I won't be able to monitor that as we go through. So I did send out this already in the poll. And so this is a question that I had asked in the poll on our app. If you have a child with autism on your caseload, and so I'm going to pull up that poll and see what we have so far. And if you haven't gotten a chance to do so, feel free to. I did it on the app. So it looks like we have some responses on here. A lot of them are yeses. We have half no's, and then a lot more unsure, like the child exhibits symptoms, but does not yet have a diagnosis. Perfect. Thank you guys for answering that. All right, so to start off, what is autism spectrum disorder? Autism spectrum disorder is a neurodevelopmental disorder that affects how a person interacts with others, communicates, and behaves. It's characterized by challenges with social communication, social interaction, restricted and repetitive patterns of behaviors, interests, or activities. It can also involve hyper or hyporeactivity to sensory input. Autism affects people of all races, ethnicities, and socioeconomic backgrounds, and it is more commonly diagnosed in boys than girls. The exact causes of autism are still being researched, but it is believed to be a result of a combination of genetic, environmental, and neurological factors. All right, so this right here is the DSM-5. This is the newest version of the Diagnostic and Statistical Manual of Mental Disorders. They just kind of revised the DSM-5. It was put out in 2013, but they revised it in 2022 to add in a couple things. So I wanted to show you a visual. This is a visual of the autism diagnostic criteria that comes from that DSM-5. And so this is just a little visual for you. This was done by, her name is Dr. Neff, and she put it in a visual format. One, because we know that somebody with an autism diagnosis is a very visual learner. And so that is super helpful. I love visuals, and because it's just a nice way to lay out a bunch of information. So on here, she changes deficits, and I don't know if you can see that piece, but she crosses it out. And instead of deficits, we're going to use differences. So persistent differences in social communication and social interaction across multiple contexts as manifested by the following, and it's got to be currently or by history. So it's happening now or it's happened in the past. And all three subcategories have to be present for a diagnosis. So number one, differences in social emotional reciprocity. Two, differences in nonverbal communicative behaviors used for social interaction. Three, differences in developing, maintaining, and understanding relationships. And then we'll sort of dive into each one of these a little bit more so that you have some examples of what they are. And the DSM-5, the newest version, made kind of an addition where it says that an autistic person may mask these differences, which may also delay identification. So this one's going to break down that first subcategory, which is differences in social emotional reciprocity. So examples of this include a tendency toward a flat affect or a monotone voice. It could be difficulty initiating conversation outside of areas of interest. It could be difficulty with small talk. Maybe they use pre-scripted lines and maybe describe it as confusing or even exhausting. Also, difficulties with that back and forth conversation, particularly in context of small talk. The next one, that second one, is going to be differences in nonverbal communicative behaviors used for social interaction. So what that's going to mean is difficulty with intuitively understanding nonverbal social cues. So body language and gestures are going to be really difficult for an autistic person, especially a child, to understand. A tendency to minimally communicate through facial expressions and body gestures. So maybe they even dislike eye contact, and not all of them do. A lot, because if we think about it, we don't have to have all of these symptoms, just a couple, right? Some of these differences, the DSM-5 is going to call them deficits or symptoms. We don't have to have all of them, just a couple of them to have an actual autism diagnosis. Then that third one there, verbal and nonverbal presentation, that is fragmented, maybe isn't even aligned. And then difficulty moderating tone and or volume of voice. And the third subcategory was the differences in developing, maintaining, and understanding relationships. So some examples of this might include difficulty initiating and developing aliastic friends. So it's what that really means is maybe friends that are of a different neurotype. So they have done some studies in the past, and somebody that is autistic, they really get along, especially children, with another person that's autistic and or neurodivergent, maybe OCD or ADHD. The difference in that neurotype. So sometimes just they call it aliastic, but maybe it's somebody that isn't neurodivergent. It's them to one would be difficulty maintaining friendships over time, difficult shared imaginative play, or even as somebody gets older, shared group projects that require high reciprocal input and output. And then difficulty with context shifting. It'd be really difficult for somebody that has autism. right, so that was all the A. So now we're moving to the criteria B. So criteria B is restricted repetitive patterns of behavior, interests, activities manifested by at least two of the following. So they have to have two of the following, the four on this one. So B1, stereotyped or repetitive motor movements, use of objects or speech. So examples of that might be or engaging in echolalia. So that echo, repetitive echoing of maybe they're saying something over and over and over. Reading phrase repetitive, maybe they're reusing an entire phrase that they heard. Lining up objects or toys, creating elaborate organization systems and collections. These activities function to self-soothe. B2 is insistence on sameness, inflexible adherence to routines, or ritualized patterns of verbal or nonverbal behavior. So examples might be finding security in routines, difficulty with unexpected changes, particularly they're not initiated change. So particular rituals like way of greeting somebody, a morning routine, rituals you may do before an exam. Those are all, again, self-soothing behaviors, but deviation from those rituals, it can cause significant stress.
Amber, can I hop in for a
To be
second? You're very, very glitchy at the moment. And your slides are a little bit behind what you're saying. Is there any way that we could get you to try to turn off your camera and see if maybe that'll help with the glitchiness?
Yeah, sorry about that.
Thank you.
Just a second. Okay, let me retry that.
Amber, would you like me to do the presentation for you, or are you gonna?
Pulling it back up. Can you see
Okay.
it yet?
Yes.
Okay.
You'll just need to do the presentation mode. Thank you. Sorry about
Yes,
that, everybody.
it's all right. Can you see the presentation yet?
No, it says you need to enter full screen mode.
Okay. Okay, is it in full screen mode for your end?
No.
Oh, great. If you want, you can pull it up and
Okay.
share if you're wanting to. It's not wanting to share the full screen again.
Okay, let me that one.
I'll try what you're
Okay.
trying.
All right, can everybody see it?
Okay.
Okay, perfect. I think this is where we stopped. Was it B2?
Okay, wonderful. Sorry, everybody. The beauty of technology sometimes is it doesn't always function how we want it to. Okay, so B2, and I'll just kind of re-go over that one real quick, but insistence on sameness and flexible adherence to routines or even ritualized patterns of verbal and nonverbal behavior. So a lot of kiddos are going to really find security in routines, and difficulty with unexpected changes could really cause a lot of maybe frustration or even significant distress. All right, B3 is going to be highly restricted, fixated interests that are abnormal in intensity or focus. So examples are going to be maybe a tendency to learn a lot about an area of high interest. This serves to self-soothe, and the person enjoys talking about this topic. So they may tend to turn all conversations back to this topic, but it can play a significant part of a person's identity. B4 is hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. So an example would be sensory sensitivities to light, sound, touch, food textures, or even taste. So that could be, for example, if you have a kiddo who's putting their hands over their ears because something's too loud, or they don't want to wear a shirt because the tag is just bothering them, that could be a sensory sensitivity to textures. Another one might be hyposensitivity, which is they're less responsive to sensory input. So on the flip side there, they might not feel pain or temperature like somebody else who's hypersensitive or who's not as sensitive. It could also be interest in visual patterns. Maybe they crave tactile experiences like touching different surfaces or smelling different types of objects. So again, you only have to have 2 of those 4 subcategories for a diagnosis. And this last piece here is the criterion C, D, and E must also be present. So criteria C is traits must be present in the early developmental period, but they may not become fully manifest until social demands exceed limited capacities, or they may be masked by learned strategies in later life. So sometimes you may see somebody going into middle school or even high school where they have more homework, changes in that social piece where maybe they're expected to go out and be more social or do these other things. So much more homework, maybe there's more sports or involvement. We may see some of these traits come out later on that we didn't see earlier. And then criteria D is traits cause clinically significant impairment in social, occupational, or other important areas of current functioning. And then criteria E is these are not better explained by intellectual disability or global developmental delay. So this is just a list of some early signs of autism in case you're working with, younger kiddos. This might be little or no babbling, little or no eye contact, showing more interest in objects than people, appearing not to hear when spoken to directly, playing with toys in an unusual or limited manner, repetitive movements with fingers, hands, arms, head, lack of gesturing or pointing, absence of joint attention, no response to hearing their name, muted emotion and facial expression, and lack or loss of language. So again, not all of these things have to be there for an autism diagnosis, but these maybe be just some of the signs that you might see a child exhibit if they, may have autism. And this one, I just wanted to share with you. I know it's really hard to see this, but this is just from the DSM-5, the revised edition, and it just shows that there are severity levels. So at the top is level 3, requiring very substantial support. A lot of times our level 3 kiddos that I work with don't have any language. Maybe they can't speak yet. They require more help with activities of daily living and things like that. Level 2 requires substantial support. maybe they're limited in some of those areas, but they can still do a lot of things themselves. Level 1 requiring support. And all of these levels, they really vary, because I have somebody that I've worked with in the past, who's a doctor and absolutely amazing. Well, if they would have gotten a diagnosis as a child, they weren't speaking when they were younger, they probably would have got a level 3 diagnosis. But this is somebody who's absolutely brilliant and doing awesome things now as an adult. So we don't really refer to them as high functioning or low functioning. It's really just differences in the support that they require. So you might hear that high functioning and low functioning. But we're trying to kind of shy away from saying that nowadays. Okay, so I wanted to share a couple graphics as we're moving into the autism statistics portion. So this is the autism prevalence in 2023 is when they got all this information. So in 2023, it's 1 in 36 people diagnosed with autism. And that is a 250% increase since the year 2000. So that's kind of a big increase. You're probably wondering, like, what contributes to that? So this one, I tried to blow it up to make it a little bit easier for you guys to see. But if you notice around the year 2000, that's when they had the DSM-3, and then not until, or sorry, the DSM-4, and then not until the 2013 when they changed it to the DSM-5. So you can see on there that it's starting to increase from then 1 in 150. And then in 2013, we've got like between, 1 in 69, somewhere around there. But what's happening, if you can see some of those things on there, is, for example, Autism Speaks was created in 2005, and that was a big thing. We had internet. We started getting internet. We started getting computers in our homes. We started to realize, okay, there, this is what autism is. And so that was kind of a wide thing. We started learning about symptoms of autism, stuff like that. But also at the same time as we're hearing about that, we're now fast forwarding, a few years down the road, we are also able to access internet in all of our homes. And now we have these really neat little tools and apps where we can go on and we can see where our kiddos are with milestone trackers and different things like that. So now as parents are seeing that their kiddos, maybe they're not lining up with those developmental milestones like they should be. So we have more awareness of it. And then around 2010, we now have 23 states that cover autism therapy. And then if we fast forward all the way to 2018, that's when 48 states covered ABA therapy for children that have an autism diagnosis. So that's when around that time frame, we saw a lot of people now reaching out to get a diagnosis because now their insurance covered it, and it made a lot more sense to go in and get a diagnosis so they could get therapy for their kiddos, where before they couldn't, or if they could, they were paying several $100s out of pocket for every hour of service that they were needing for their kiddos. So all of those things combined really contribute that. Another piece is in 2013 when they changed the diagnostic criteria, they included things like Asperger's and pervasive developmental delay and several others that were their own diagnosis. They've now pulled those in, and it's now just under this umbrella of autism. So now we're also including more people in an autism diagnosis than we were in the past. So those are just a few reasons why we now see so many diagnoses happening like this day and age. There's just a ton. And I'm sure there's more that you guys can think of as to reasons why we're seeing some of this. But yeah, that's just a nifty little graph that I had found that I wanted to show you. All right, so the next piece is navigating the diagnosis. So in Kansas, helping a family navigate an autism diagnosis involves several important steps. So which a home visitor can really guide that family through. So here's an effective approach. We've got a couple things to talk through for this, but number one, understand the diagnosis process. Ensure that the family is familiar with the process of receiving an autism diagnosis. So in Kansas, a diagnosis can be made by a developmental pediatrician, psychologists, and neurologists, or other multidisciplinary teams. Families may be referred by their primary care provider. So if you have somebody who's not sure, have them go to their primary care provider and really, really push that they want to see one of these people to try to get a diagnosis. It can be, there are wait lists, so it can take some time. Just know that ahead of time. It can take some time, but there are a lot more people giving a diagnosis now, where insurance actually accepts those diagnoses. The psychological evaluations or a neurological eval, like for example, United Healthcare has their own criteria of what they choose based off of research and things like that they use when they're looking to say, yes, we'll allow this person to get that diagnosis. But if you stick to developmental pediatricians, psychologists, neurologists, you'll have some good luck there. And a lot of times, like a neurologist can help you schedule with somebody else who can get that eval done, a more in-depth eval. And then number two is provide emotional support. So a diagnosis can bring about many emotions. So listen actively and provide reassurance, normalizing their feelings. Offer hope by highlighting early intervention and available services. Number three, guide them to early intervention services. So in Kansas, children under 3 can receive, a lot of children can receive free early intervention services through infant toddler services. Home visitors should be familiar with those in their area and guide families in contacting their local network for screening and assessment. For children over 3, help those families connect with their local school districts for an evaluation under the special education services. Schools are required to provide free and appropriate public education under an individualized education program if that child is eligible. Number 4, access to applied behavior analysis or other therapies. Many families benefit from ABA therapy, and Kansas covers ABA under Medicaid, which is KanCare, and private insurances due to the Kansas Autism Insurance Mandate. Assist families in understanding their insurance coverage or applying for Medicaid if they're eligible, because Medicaid KanCare is going to cover 100% of ABA therapy services. And a lot of times with ABA, you may get 5 hours of therapy per week, anywhere up to 30, depending, or even more, depending on that kiddo and how much they need. So help them explore other therapies like occupational therapy, speech therapy, and even physical therapy if they need. And a lot of times, feeding therapy is also available by a OT or a speech and language pathologist. Number 5 is help with financial resources. So Kansas has the autism waiver under Medicaid, which helps cover intensive autism services for children under the age of 5. However, there's often a waiting list. So if you can, assist that family in applying early on and seek those services, because there's definitely a wait list, especially in the Wichita area. But you can also direct them to financial support through the Supplemental Security Income, that SSI, for children with disabilities if they do have an autism diagnosis. There is financial requirement, though, to get the SSI, but if it's around what Medicaid is. So I see a question pop up just from there. What is the autism waiver and how does it work? Those are a lot of really good questions. They do provide some services. It's it's different areas kind of provide some different things, but I do know, and I can only speak to the parents that have this. They do have like case managers that will help them navigate through the system, that will really help advocate for them, help them. Some even get, free diapers, which if a kiddo's, I think, over the age of 5, a doctor can write a prescription for diapers for incontinence, and Medicaid will cover that. But there's a lot that goes into that waiver. So I don't think I have the time to add a bunch to it, but definitely check it out. Go on and Google that and see all the things that they provide. They do help with a lot of things. Number 6 is support network. So encourage the family to join local support groups, or connect with organizations like Autism Society, Heartland, or there's Families Together. We've got Parents as Teachers. I bet you guys could throw out more than a dozen, and maybe I'll have you do that even at the end, of support networks that are available within the state of Kansas that provide resources and parent training. So yes, and seeing another home and community-based services with the autism waiver. Yes, there are services they do offer. Respite is another one, respite care. I provide home community-based services through Medicaid to do autism therapy, the ABA therapy. And then ABA therapy provides parent training through insurance. So there's now a requirement that anyone that is getting ABA therapy has to get some type of parent training that teaches parents, what is autism, what is ABA, how do we help these kiddos, all those kinds of things. So that's kind of nice. Number 7, provide resources and education. Educate the family on developmental milestones and what to expect moving forward. Provide materials on autism to help them better understand the diagnosis. We do know that with milestones, it's kind of spotty with autism, but we do still want them to try to hit those milestones in order, even if they're delayed. Offer referrals to community resources, such as behavioral health providers, ABA parent training services, insurance caseworkers, or even social caseworkers who specialize in autism. By providing practical guidance, emotional support, and connecting them to these vital services, home visitors can help families feel more confident and supported through the autism journey in Kansas. Perfect. I love seeing the chats. They're going too fast, so I'm not able to read all of them, but I love that you guys are throwing those out there. So the next piece, I wanted to share a little bit more about navigating the diagnosis. So each insurance has criteria of what type of provider that they will accept a diagnosis from, and the types of assessments and observations they accept. Each insurance has criteria of what type of, for example, ADOS, you'll see on, I think it's the next one, so you can stay here for a second, but on the next screen, you'll see a list of them on there. ADOS, CARS, those are a couple of the big ones. But once you find someone to do that eval for you, you usually have to get put on a wait list to get a diagnosis, and it can range between 3 and 9 months. I've called around recently to get the feel of what wait lists are like right now. And some of them are even March, April, May of next year. So it's super important, if you see those early signs, to get them on a wait list to get a diagnosis as early as possible, because they may have to wait a little bit. Okay, so yeah, this is the list I was talking about. This is just an example from United Healthcare CanCare, just so that you guys can see. But this is for them to be able to give a diagnosis and to understand the severity level. They have to confirm all of that through a lot of these different ones. Not all of them, but the majority of them have to be included. And whenever I submit a treatment plan, they're looking for the ADOS and the CARS. Those top 2 that are bolded, they're really looking for those. Sometimes they want both, sometimes they want one or the other, and then some of the others that are listed there. But that's just so that you have an idea of what they're looking for. So the role of the home visitor is next. So home visiting programs offer support, education, and resources to families. You guys all do such an amazing job, like every single day. But home visiting is absolutely critical for families with children on the spectrum. Home visitation provides personalized in-home support, and it's important to build strong, trusting relationships between home visitors and families, because that having a kiddo with a diagnosis or even without a diagnosis, they feel a lot of times, with my experience over the years, very kind of isolated. There's not a lot of other people that they can relate to. And it is really, really hard, especially if the kiddo's not wanting to go outside or can't go outside into the world and do other things. And so I see something pop up. Is it possible to get a diagnosis after the child is 18? Absolutely. I've had a lot of parents through the process of teaching them what autism is. They've realized, hey, oh my gosh, I might have autism. And so they've then gone and gotten their evals done. They started with their primary care physician, and then they asked to see a neurologist. And then they also got a psychologist who can do like a psychological evaluation and kind of go through specific things, looking for autism and ADHD and a lot of those things. So it's the same for an adult as it would be for a kiddo. And they'll use a lot of those same assessments and things as well. Great question. Okay, so building rapport. Rapport is just relationship, right? We want to build rapport and trust with a family that has an autistic child. And that requires sensitivity, empathy, understanding of both the family's and the child's unique needs. So here are just some key strategies for home visitors to be able to foster that trust so that we can build that rapport and that relationship with that family. Number one, listen actively and empathetically. Acknowledge their experiences. Families often go through a lot before and after a diagnosis. Just be attentive, be an attentive listener, and validate their feelings. Even if you don't know what they're, going through, but validate their feelings. They're real. It's tough. Avoid rushing into solutions without first understanding their concerns. Make sure also to ask open-ended questions. Get to know that family's routines, their values, and their goals for their child, because every single parent has different goals for their kiddo. Every single one I've worked with, different goals. So let them express what they're proud of and what they find challenging. Number two, respect the family's expertise. Recognize the parents as experts on their child. Parents often have the deepest understanding of their child's needs, preferences, and behaviors. So acknowledge and appreciate this expertise by asking for their insights and input. I always ask my families, what kind of goals do you want to work on? And those are what we really work on first. What do you want to see? What's important to you? And making sure that we're empowering them at the same time. And we want to make sure we also ask about what, all the awesome things that their kiddo does. At the same time, we want to, recognize those things. And then lastly, honor their routines. Respect the family's daily routines and caregiving strategies. Do not impose your suggestions without considering their current approach. Sometimes we know that research says something, and then maybe a parent is not quite doing that exact thing. But if you don't have a child in your home that has autism, you don't know. You don't know. It is a very different thing parenting a child with autism. And so we want to make sure that we take their approach into consideration, because it might be the best thing that that parent could come up with in that moment. Be consistent and reliable. Follow through on commitments. So consistency builds trust. If you say you'll provide a resource or follow up on an issue, make sure you do so promptly. Arrive on time and be present. Being reliable in your visits and showing up prepared indicates that you value their time and are genuinely invested in supporting the family. And if we go back to the DSM-5 and think about, if we remember the routines, right? And some of those things that children with autism struggle with routines, changes, transitions. Those are really hard for them. So if you're going to be there at 2 o'clock in the afternoon, be there at 2 o'clock in the afternoon, because if you're there at 2:20, oh man, that kiddo might just be having a meltdown by the time you get there. You don't know. Be on time and be present. Let them know ahead of time if you're not going to be there, or if you're running late, you can let them know, hey, I'm running late today. I was at a train. I had to sit at a train for 5 minutes to wait for them to back up. I text my parent a picture of the train. I said, I am so sorry. I'm on my way. Please let my client know that I'm coming. I will be there, but I'm running late. I'm not sure when I'll be there, but I'm running late. So that way it helps them understand. It lets them know. Consistency helps an autistic child by providing routine and allows them to know what's coming next, because that's huge. We want to know what's coming next. We don't always like surprises. Our kiddos with autism, they want to know what's coming next. They need to know. It's super helpful. Be consistent. That's crucial for an autistic child. Use clear and supportive communication. So simplified technical terms. While you may be knowledgeable about autism, avoid overwhelming the family with jargon. Explain things in an approachable way, offering to clarify if needed. And then, of course, share information thoughtfully. So you need to provide feedback or recommendations. If you do so in a very positive and constructive manner. Focus on the strengths of the child as well as areas for growth. Provide a lot of positive reinforcement, hey, I really like how you do this. Oh, I love when you do this, that makes me, like I enjoy seeing you do this with your kiddo or whatever. We want to also provide some positive reinforcement to the parents or the caregivers that we're working with as well. Number 5, respect the child's individual needs. Be flexible with engagement. Not all autistic children will engage in typical social behaviors. That's part of the diagnosis. Respect the child's communication style, whether they're verbal or nonverbal, and adjust your approach to match their comfort level. Last week, I did a session, 2 hours. I sat there with the caregivers and the client. We talked maybe like back and forth 5 times. The kiddo did not want us talking. They had just woken up when I had gotten there. They were not ready for it. We sat kind of quietly. We played, we built blocks, we did our stuff, but we did it quietly. We respected that kiddo just didn't want that. And that's not how they always are, but that day they were. So we respected that. We still were there and we still sat there and played and supported them. We did a lot more modeling that day, but we adjusted how we did it for that particular kiddo on that day. Also understand sensory preferences. Autistic children often have specific sensory sensitivities. So learn from the parents what may trigger discomfort or anxiety and adjust the environment accordingly during your visits. And last week I had a visit with a kiddo and the parent told me it was okay to share this, but the kiddo, I'm new with this kiddo. And so I was like, okay, do they like water? And the parent said, yeah, they love to pour and play in water, but they don't like to be wet. And I'm like, okay, that's good to know. So I brought a mat to put down on the ground. I asked the parent for a couple towels. We had this huge tub full of water, all these really fun play toys that we could play in the water, pouring, dumping, all that fun stuff, some spinny things. It was fantastic, but I had to remember to let the kiddo know, hey, it's okay if you want to wipe yourself off. It's okay if you get wet, you can wipe yourself off. If you get too wet and you feel like you need to change, there's clothes over there. You can go over there and you can change if that's something that you need to do. If I hadn't prepared and done all those things, I think that kiddo, when they got their hands wet and they were like, oh, my hands are wet, they would have stopped at like the 5-minute mark and we wouldn't have been able to continue. But because I had the towel and I say, oh, it's okay. You can, just dry your hands off. You dry your hands. Okay. We made it 2 hours, almost 2 hours. I think we stopped 15 minutes early to like dry everything, and clean up, but we almost made it 2 hours of playing in that wet water. And that kiddo doesn't necessarily like that. So we just have to prepare sometimes when we know that they maybe dislike a certain thing. Number 6, provide emotional support. Just be calm and have that reassuring presence. Parents, they may feel overwhelmed. Let me restate that. Parents are going to feel overwhelmed, not may. They're going to. Every parent I've ever worked with feels overwhelmed. It's a lot. Particularly in the early stages of diagnosis, they're going to be overwhelmed. So just offering steady emotional support and showing compassion can really create a strong connection. And then encourage self-care. Gently remind caregivers, like I said, gently, of the importance of taking care of themselves. Be mindful of signs of caregiver burnout and offer resources when appropriate. It happens a lot. Caregiver burnout happens all the time. And so I have to, we talk about self-care constantly is a goal for my parents is we are always talking about self-care, even if it's just a couple minutes in the car before you pick up your kiddo, taking some deep breaths or listening to your favorite song, something that they can do for themselves. Number 7, empower. Don't instruct, empower. Collaborate rather than dictate. Frame suggestions as collaborative problem solving rather than directing them to make changes. Ask for their thoughts on how to approach specific challenges. We want to collaborate with them. Celebrate small victories. Highlight progress, no matter how small. Highlight it and celebrate the child's successes with the family. Today, a kiddo said up for the first time, like in relation to like these animals were going up the mountain. And I was so excited. We're jumping around. I'm like, yes, you said up. Like, nice. Like, you are learning that means up. Mom, guess what? The kiddo is saying up. We're understanding these things. That's so exciting. And then, hey, I love, how much effort you're putting into this session with me today. I can see you're really learning and you're working so hard. Just celebrating those small things can really help the kiddo, obviously build self-esteem, but it can also really help the parent as well. Number 8, cultural competence. Respect cultural values and practices. Every family I work with has a different background, different cultures, different religions, different everything. We have to make sure, because families have different cultural or personal beliefs that influence how they approach parenting and autism, we have to make sure we understand that. We have to take the time to understand these beliefs and be respectful of their perspectives, right? Going into somebody's house who is Native American, they're going to have very different cultural and spiritual beliefs, and that might shape how we do things, and that's okay. We want to make sure we understand those things and that we're being respectful. I always ask before I go into a new person's house, would you like shoes on or off? Would you like me to take my shoes off before I come in, or do you guys have a rule about that? A lot of times people do have rules about that. They would, prefer you take them off. Some of them don't care at all, but just asking those simple things can be super helpful. And 9, build trust gradually. Be patient. Building trust takes time, especially if the family has had negative experiences with professionals before. And in this field, it's a possibility. So be patient and give the family time to feel comfortable with you. By showing respect, understanding, and a willingness to adapt, a home visitor can create a supportive and trusting relationship with the family. This trust will enable better collaboration and outcomes for both the child and the family. All right, so practical strategies. So when a family receives an autism diagnosis for the child, a home visitor can play a crucial role in helping them understand the diagnosis and what it means for the child's development. So here's how a home visitor can guide and support the family. I'm going to kind of briefly go through these because I know a lot of you are already doing these things and I want us to spend some time with Q&A. So we'll kind of briefly go through these. So explain the diagnosis in simple terms. So break down what it is. It affects communication, behavior, and social interactions. Highlight that it's a spectrum, meaning that every child is different, that every single child I've ever worked with is different. Clarify misconceptions and normalize the child's experience. We'll move on to this. Number 2, focus on developmental milestones. Describe the impact of key areas of development. We're going to focus on communication, social skills. The next piece is going to be on the next slide, behavior, sensory sensitivity. So those are all from the DSM-5. Those are going to be those things that we're really working on. Some of the things that we don't do is, for example, hand flapping, spinning, or any of those repetitive motor movements. We're not going to try to stop those behaviors because those are self-regulating things. Those are things, unless a kiddo is banging their head or hitting themselves in the face, those can be really self-soothing. So we're not going to necessarily try to stop those kinds of things. Lining up toys is perfectly fine thing for a child to do. Why not line up toys with them? And today I lined up 100 zebras. I'm not even kidding. I think there might have been 100 zebras. We lined them up. It was a little stampede, and it was all over the table, all over the floor. I mean, it was a herd, and it was fun. We interacted, we played, we learned a lot today during this. And then, of course, the last one on here, emphasize strengths. So just highlight their abilities, their strengths, their creativity, all of that. Help the family understand individual differences. So reiterate that every child with autism is different. In that last paragraph there, provide resources for specific concerns. So potty training, socialization, language development, different therapies can offer different resources for those. Number 4, empower the family with knowledge of early intervention. A lot of you guys already do all of this, right? That early intervention piece. And of course, just discussing available services. So really get to know what services are available in your area. Also, you can partner with schools if they're older and help with the IEP processes, if that's something that you can do, or at least guide them to the websites, the KSDE websites and stuff that will have a lot of that information. Number 5, provide visual supports and examples. I threw this in there because visuals are awesome. And if I had the time to create every single page as a visual today, I would have, but I just didn't have that time. But visuals are super helpful. And then also explain with real life examples. So give them examples to help. And the next page will be addressing emotional reactions. So acknowledge and validate emotions, because receiving a diagnosis can sometimes cause a lot of grief. Sometimes a parent has this vision of what they think their child's going to be, and then sometimes it's really hard to see that maybe they won't have that kind of a child. And then also that last paragraph, provide a safe space for questions. Allow them to come to you with questions. Even if you don't know the answer, you can try to find the answer out, but at least let them be their safe person to talk to. Number 7, help them develop a positive outlook. Focus on progress and growth. And then that last one, that last paragraph there, set realistic expectations. So helping them set small, achievable goals can really help. Really focus on progress that their kiddo's making, even that small progress. Number 8, share resources and supports. Offer handouts, book recommendations, links to reputable websites. There are a lot of things on Autism Society, Autism Speaks. The CDC website has a ton of really awesome information about autism. So I would even go there and see if you can find stuff. And then connect them, if in your area you have support groups, connect them with local support groups. I know in our area, we do have those things. And so there are some support groups for it, but not in all areas. 9, encourage collaboration with professionals. So work with the family's team. And then that last piece is emphasize the importance of advocacy. We want to make sure that we're working with the whole team, whether it's healthcare, education, community. We want to make sure that we're working with them. We know what other people are doing or how they're helping them. And 10, reassure the family that they're not alone. Just remind them that help's available. And so by providing clear, compassionate, and tailored information, a home visitor can help the family better understand their child's diagnosis and how to support their child's development. All right, so now is a good time. I wanted to save some time for you guys. If there's a question, to type it in the chat box, and I will be happy to provide the answers that I can. If I don't know, I'll tell you. I don't know, but if I don't get to yours, please feel free to email me. See, I'm going to open it. Perfect. Yeah, there's my email. You can email either one. You can email my business one, Behavioral Training Solutions, or the Kipata one. And I'd be happy to respond if you have other questions or things that you maybe don't want to ask on here. Please feel free to send me an email. I'd be happy to talk through some things with you. Says, is it typical in most areas to have an issue with getting into a specialist to get a diagnosis? Seems like it can be months before the child can even be seen. Yes, that's pretty typical. It can take, because we have the rules changing in the last like 6 years of more insurances, being able to pay for it. We've had just this huge influx of people wanting to now get a diagnosis because now they have a reason to. So there's just not as many specialists that provide the diagnosis as there are people needing one. So yeah, sometimes it can be upwards of 2 years in some areas. But if a family is willing to travel to different places, there are places, Kansas City, Wichita, those bigger places that do have developmental pediatricians or psychologists that will do some diagnosing, that have more staff, so the wait time is a little bit less. Great question. Any other questions today? Well, if there's no other questions, I was just, you're welcome. I'm hoping that you can type in the chat box something that you learned today that you didn't know before. So if you could take a second, and it can be one sentence, it could be one word, it could be a couple sentences, whatever that is, and just shoot that in that chat, so that way I can see some of those things. Consistency builds trust. Yes, absolutely. That's huge. It's huge. If your parents and families can trust you, you can do so much for them.
Amber, we do have a question. Do you have any insights on how parents can support siblings who have an autistic sibling?
Great question. That's a great one. I have a lot of, for example, I do therapy with my clients, and their siblings are all involved in the therapy. Like the whole family's typically involved. Sometimes you've got grandma, sometimes you've got siblings. But I like to include siblings in that as well. So if they're already in like ABA therapy, you can try to get the sibling involved in with them just to work, with them and kind of help them understand. But other than that, there's not a lot of like support groups or anything like that for kiddos. There's some resources like books available. Like I have a lot of cute little books that I share with siblings. So if you were to go on Amazon and Google autism books for children, you'll find a list of a bunch of them. And those books can be really helpful in describing it to a sibling. And if you want any more information, feel free to shoot me an email and I can help you with that. Yeah, I see a bunch of things. Yeah, not saying high functioning or low functioning phrasing, that's good. How to walk alongside a family as a parent educator as they go through the journey, tips and tricks, how to approach conversations. Yes, yes. Yeah, with if a kiddo is on has can care, they can receive ABA. As long as they have a diagnosis, they can receive ABA therapy. Yeah. So yeah, it is nice that it's covered. It started about, like I said, 2018. So it's been really nice to have those kiddos covered 100% through Medicaid. Wonderful. Thank you guys so much for participating. Oh yeah, Autism Speaks first 100 days. Yeah, great resource. Yeah, there's some great resources out there. On I have a references page with, several dozen articles. If you're wanting that information, again, feel free to reach out to me. I'd be happy to send you the reference list that I have of just a bunch of different articles to read. But CDC really does have a ton of really good information. There's even an autism tracker on there. And it kind of walks through like the DSM-5 criteria, and you can kind of click in there and see if a kiddo may have autism. Even like if a parent is curious, you can kind of send them that resource and they can do it themselves.
If nobody has any more questions, we're going to go ahead and end the session. I want to thank everybody for coming today. We really appreciate you being here.
Thank you.
Thank you, Amber, for all the wonderful information.
Absolutely. Have a good one. Bye, guys.
Okay.